Hey everyone, thank you so much for attending our webinar here today. I am Jordan. I am the membership director with the Chambersburg Chamber of Commerce, and I'm really excited to cover our topic here today. Hopefully all of our chamber membership is aware, and everybody who's not a chamber member knows that we offer great programs exclusive to our membership. And one of these opportunities is through our ChamberChoice program, and it comes from a team called the My Benefit Advisor Group. They're a group that covers a lot of different things essential to a lot of different business needs. So basically what I wanted to do here today was anybody within this group that has any questions, if you want them to be somewhat private, go ahead and send them to me through the chat. And then whenever Craig or Dan opens things up for questions, I would be happy to go ahead and, ask those questions for you. That way, things are somewhat privatized. So without further ado, I would love to introduce my friend Craig Pritz and Dan DeLuca from the My Benefit Advisor Group. Fellas, thank you so much for joining me here this morning. Or this afternoon. I'm sorry. Geez Louise. Don't even know what time it is here right now.
Time flies, days fly by. Yeah. Thank you so much for having us. We're really excited to be here. We're excited to talk about the program, the changes the program has gone through over the last 1.5 to 2 years, and truthfully, just all the exciting benefits we can bring to the members today. It's been a long time since I think the chambers have had a really strong added value benefit like this, like we have today. And so we're really excited to get the word out. So
well, thank you so much, Craig. Yeah, you have a PowerPoint or something like that you're hoping to share with us here today?
I got a lot of different information and a lot of formats that I'm going to share with us as we go through. First, just a little bit of introductions on our side, who we are, things like that. My name is Craig Pritz, as you mentioned. Thank you so much. I am with My Benefit Advisor today, but I started with the ChamberChoice program back in 2007. That was the first year that I started working with it, but the program itself actually started in 1992. It was back in 1992 when a handful of chambers came together and formed the program, and I'll go into all this great history and detail, but I got to join in 2007. I started working in every department we had, from service to sales to billing, learned the industry, and since then I have worked with individuals, small groups, large groups, and just about every benefit under the sun. So that's a little bit about me. I've been involved with the chambers, like I said, for the past 13 years. Dan is part of our team here today, Dan DeLuca. I'm going to let him talk. Him and I work in little different segments for your members. We do break up how we work with your members because there are some benefits that make sense for different size groups.
Sure.
So Dan and I will both be working with your membership, and I'd like to introduce him for a second so he can just talk a little bit about his history.
Thanks, Craig, and thanks, Jordan, for having us here. I started in this employee benefits industry back in 2007, and I worked for another company before that in an own agency, and then I came on with My Benefit Advisors about 2 years ago, and starting to get kind of the grasp of the ChamberChoice program now and what we, are able to offer to the members now, which, as an independent agent before with a different agency, we did not have that ability. So it's a good benefit to have, and I'll go over some of the stuff that we have to offer you as well. So thank you.
Yeah, thanks, Dan.
Excellent. So let me go ahead and share my screen here, and then we'll get started going through some of the information. Really what I want to do is start by talking about the history of ChamberChoice, just for those who aren't really aware. Everybody seeing my screen okay right now?
We are, Craig, I believe. Yes, at least I am. I think everybody should be seeing what I'm seeing. So great.
Awesome. So thank you very much. So first, let's start by talking a little bit about us. And the truth is that the ChamberChoice story goes back even prior to My Benefit Advisor. ChamberChoice was formed, like I said, in 1992. It actually started when a handful of chambers came together around the Pittsburgh area. And believe it or not, health insurance was a problem even back in 1992. And they said, how can we bring better options for our members? So many years ago, a group of chambers get together. our company got involved, and at that time, we went out and we negotiated a discount with Highmark Blue Cross Blue Shield. Shortly after that, the program expanded into the central part of the state and partnered there with Highmark Blue Shield. Those who remember the heydays of ChamberChoice 20-some years ago will know that that was really the most cost-effective way to buy health insurance 20 years ago was to join a Chamber of Commerce. You just couldn't get a better deal on the street than you could through your local Chamber of Commerce. So the program started that way. Over the years, the program did change. I mentioned that great benefit from a cost standpoint that the chambers had. Probably one of the biggest changes was increased competition to the area. Central PA saw companies like Geisinger moving down from northeastern PA, and more recently UPMC moving in from western PA. So increased competition had an impact to the ChamberChoice program, but ultimately the Affordable Care Act came along and made it illegal to provide discounts through associations the way that we did in the past. So passing of the Affordable Care Act kind of made the ChamberChoice program kind of shift gears a little bit and start looking at other ways to help businesses. We got into things like compliance at that time. Department of Labor was doing a lot of audits. I'm going to talk about compliance here in a few minutes. But we brought some ERISA attorneys to the table at that time, and we started looking at some different products to help employers cut their costs. Things like level funded products. We'll hear about those in a few minutes as well. That's where ChamberChoice was up until about a year and a half ago, 2 years ago, when ChamberChoice, at that time managed by JRG Advisors, merged with Emerson Reed. Emerson Reed is part of the USI family, one of the largest insurance companies around. And USI has a philosophy that companies of all sizes should be able to get the same benefits that a very, very, very large company can have. Larger companies, a lot of times, are able to take advantage of additional benefits, and sometimes those don't always trickle down. So USI created this My Benefit Advisor concept and company, and we manage the ChamberChoice program now. And one of the primary reasons is because of the added value benefits that we can bring that I'm going to talk about. That's one of the most exciting things with ChamberChoice right now. So ChamberChoice has gone through a lot of changes over the years. The most recent was the merger with Emerson Reed and the creation of My Benefit Advisor. Primarily, ChamberChoice covers 3 areas. I'm going to focus today on employee benefits, but ChamberChoice also has an energy program and a business insurance program that members can take advantage of as well. I'll real quickly cover those, and then we'll get into the meat of the employee benefit side of things. The energy program, kind of a really neat story here. Back, I'd say maybe 15, 20 years ago, one of the very first companies to be deregulated from an energy standpoint was a Pittsburgh company by the name of Duquesne Light. A couple of the employees that worked there, some of the engineers, left Duquesne Light after deregulation and started a company by the name of On Demand Energy. They started working with chambers and school districts and churches all across the state to help them manage their energy. On Demand grew to be one of the largest managers in the tri-state area. Maryland, Pennsylvania, Delaware, they eventually grew New York, Ohio, New Jersey, West Virginia, and now they're part of the World Connect Energy family, one of the largest managers of energy in the world. As a chamber member, they are a free resource for you in a lot of different areas. Your business pays your own energy bill. Reach out to them. Ask them some questions. Is there anything I can do to cut my cost? You got any special programs I can jump on right now? Am I good where I'm at? They're your free, behind-the-scenes resource to help educate you when it comes to energy. Looking to buy or build a new building, thinking about going green with your new building, you want to reduce your carbon footprint, you want to put in solar panels, reach out to them. You want to know how to align your electric circuit board so that you don't draw too much energy. Reach out to them. They're your free resource. They have a residential program as well that can help you save a few dollars at home. So great program there for energy. The other part of this, what some people call the three-legged stool of ChamberChoice, is a business insurance program. Business insurance program features Penn National. Penn National, great insurance company. They've been around for over 100 years. They handle things like workers' comp, errors and omission, liability, your vehicles, your computers. they who handle that side of your business insurance. I'm not going to guarantee they're going to be the lowest rate every time, but I will tell you as a chamber member, you owe it to yourself to get a quote from them every year, because when they are the best fit, they will put you into a dividend risk pool. What that means is at the end of the year, they look at the claims, they look at the cost, things performed well, they return dividends. They've returned dividends that have been as high as 12 and 14%. Think about all your business insurance combined: workers' comp, errors and omission, liability, vehicles, computers. You add all that premium up, then figure out what 10% is, 14%, 12%. The dividends have been as low as 2% as well. But it's a great program that exists for chamber members. Again, I don't guarantee Penn National would be the best fit for every company under the sun. But as a chamber member, you owe it to yourself to take a look at that program, because if that's the best fit, and keep in mind, that's a 100-plus-year-old company with an A-plus rating. If they're the best fit for you, you have the potential to get money back at the end of the year. Not a lot of insurance companies are giving back money at the end of the year. So those are two separate pieces of Chamber Choice. Today, what I really want to focus on, though, is the employee benefit side of things. This is where we've had the most changes over the last year or so. This is where I think we're providing a tremendous value these days that people need to be aware of. And unfortunately, in the time that we're in right now with what's going on in society, there's a lot of benefits that are helping employers get through that. And so that's what we really want to focus on today. So let's get into that a little bit. First thing we want to talk about is just the approach. We feel that it's very fresh, very, very new, very different. Every call we get starts out the same. Can you help me save money on my health insurance? And the truth is, we can probably help you in a lot of different ways, but let's talk it through. And that's where our approach is a little different. There's 4 key areas that we help businesses. Number 1, it's consulting. It's learning about a business, learning about their situation, where their employees are located, what networks are the best fit for them. Are they a good fit for level funded or a PEO? All things I'm going to talk about today. But in consulting, that's where Dan and I really do our job. That's where we take all the pieces to the puzzle, dump them out on the table, and try to make the best picture for you. So consulting is one area that we work in. And I think a lot of people, kind of get into that area a little bit. What's unique about us, and you'll hear more about this, is our consulting is just not going out to quote 3 or 4 local insurance companies. Our consulting is to look at different insurance companies, different programs, different funding mechanisms, different ways of packaging your insurance. That's really consulting to us. Enrollment. In today's world, everybody says, well, of course you do enrollment. You're the broker, right? Well, yeah, that's true, but there's a lot of different ways to handle your enrollment. Do we print a bunch of paper and pass it out to everybody face to face? And do you need help printing that up and making it look really good and conveying the right message of what your benefits are to the employees? That's one way to do it. Would you rather do it electronically, where we have open enrollment, where we send a link out to the employees? That can be an option for some companies. So how we handle enrollment is something that I'm going to talk about more. But in today's world, with people being quarantined, enrollment is something that we have to make sure we're doing right, because it's tough to handle enrollment when everybody's in a different location. Management, account management. One of the biggest areas that I think that we can help businesses throughout the year is to best understand that business. And that ties into our account management. And I'll talk in detail about how we handle that, a service calendar, our service team, but what that means. But managing the benefits throughout the year is very important. We hear all too many times, I only talk to my broker at renewal or if there's a problem. Shouldn't be the case. There should be scheduled times that you talk about things. I'll get into more detail on that. And compliance. Compliance is probably the scariest part of my job for businesses, because the truth is, if you offer any group benefits whatsoever, you're subject to compliance. ERISA was passed. I'll go into detail to what ERISA means, what the Department of Labor is doing these days, what the Affordable Care Act, what impact that had. Compliance is serious because the fines are very, very large. So we'll get into compliance, but these are the 4 main areas when we talk to your business that we want to make sure that you're covered in. yeah, I want to find you the lowest health insurance rate out there. That's what everybody wants under the sun. But I also want to make sure you're protected. I want to make sure your enrollment is handling right. I want to make sure that somebody's managing your benefits throughout the course of the year. So that's a little bit about our approach and how we handle it. Let's get into what some of those things really, really mean, though. So we want to talk about consulting today. And when it comes to consulting, there's a lot of different ways that we can help a business save money. Dan and I, we get into a business, and like I said earlier, you've got all the puzzle pieces. We need to dump them out and make the best picture for you. Are we consulting you on going to an ACA rate through one of the local insurance companies or through a national insurance company? Or are we consulting you on some of the special level funded products that are out there where we get some unique deals? Or is our consulting looking at a health savings account, a health reimbursement account, a group medical captive? These are all different ways that groups can control their cost. And you may hear little bits and pieces of these things and not maybe fully understand what all of them are, but we do. And we want to help you understand these things and find out if these are the best fit for your group, if this is the best vehicle. So let's talk about what some of these things really mean. What is an HSA? What's a health savings account? I get calls from people saying, Craig, I want to put in an HSA. Not really sure what it is, but I think I want to put one in. An HSA is a health savings account that allows an employee to put money aside on a pre-tax basis. An employer may contribute as well, or any third party, but it's really designed to give the employee a vehicle to put their money aside on a pre-tax basis to use for out-of-pocket expenses. And that could be a long list of things. That can be the things that your health insurance plan covers, your co-payments, your deductibles, your out-of-pocket expenses. But it also ties back to things like your vision, your dental, durable medical equipment. There's a lot of things that are qualified by the IRS for you to use your health savings account dollars to pay for. But here's where it can benefit an employer. An HSA, by design, has to meet certain IRS guidelines to be considered qualified in the first place. Insurance companies offer HSA plans as alternatives for their members. Depending on how you're rated, depending on how your rates are calculated, an HSA plan may generate some really significant savings, or it might be more in line with some of the plans that have co-payments that are very similar to the HSA plan. But either way, we will look at that for you. When an HSA plan can generate some savings, it can be a very good fit for a company because it helps an employer cut cost. It helps employees put money aside and use pre-tax dollars for their out-of-pocket. And just real quickly, I'm going to touch on that real quick. We think about our co-payments we pay today, $25, $30, our deductibles, $500. The idea of paying those items with a pre-tax dollar, paying our out-of-pocket expenses, actually means we're using less money to pay for those. The end of the line impact to us is when I pay something using pre-tax dollars, money that I did not pay taxes on, I'm saving in the end. So there's a benefit to the employee. There's a benefit to the employer as well. HSA plans can make sense for a lot of people, but they're not the one size fits all, just like everything I will talk about today. So an HSA plan can be a very good fit for people, but it also can be a good second option. What a lot of employers don't realize today, selfishly, I'm very proud to say that we had a lot to do with this as a company about 10 or 15 years ago. Employers today of almost any size can offer choice in their health insurance plans. You can contribute a certain percentage to one plan and let your employees pick from 2 or 3 or 4 plans. Depending on your size, that can make more sense to have more or less plans. An HSA can be a great option for your employees. How many people have you hired over the years that have come from other companies that have an HSA in place now and would love to continue to use that? But then you have other employees who don't want anything to do with an HSA because it's new to them. It's something that they've not used before. Offering both plans can be a great way for an employer to keep more employees happy. So HSA is something we'll look at for you. I want to talk next about something that we confuse with HSAs. We love our initials in this industry. HRAs, or a health reimbursement account, or a health reimbursement arrangement. An HRAs are a really great way for some people to control their cost and still offer benefits that are very, very rich. And what we mean by rich benefits is we mean not a lot of out of pocket. Let's start by being honest. You know, younger people on this call may not realize these things. Some of us older people will. You know, if you go back 20 years ago, we all had a zero deductible health insurance plan, and our employer paid a ton of the cost of that, maybe 100%, maybe 90. But if you think about what benefits looked like 20, 25 years ago, we never had deductibles. We had zero deductibles. We had very low co-payments. You know, everything I did cost me like $10, $20, and that was it. Insurance has really changed. The insurance companies love to use words like cost sharing. Well, that's a fancy way of saying that you've got more out of pocket now than you've had in the past. And so as the plans have changed over the years, employers have had to look for ways to control their cost. One of the ways employers can control their cost is by moving from a very, very low deductible health insurance plan to a plan that has a higher deductible. And immediately some people think, well, all that's doing is shifting the cost to the employees. Well, if you just stop there, that's true. You've just shifted the deductible, the out-of-pocket, back onto the employees. But what a lot of employers have recognized with our help and us putting together some cost analysis for them to show them this in writing is a lot of employers can move to a higher deductible, generate some significant savings, offer to pay part or all of the employees' deductible, and still save money in the end. And I have people look at me and say, well, how is that possible? And I'll give you some real rough number examples here. You have a zero deductible today. You move your plan to the $1,000 deductible. You save a significant amount of money, but out of your savings, you take some of that money and you pay back the employees who use their deductible. Well, right out of the gate, any study you've looked at across the country will show you that roughly about 30% of our employees actually meet their deductible. Now listen, if you're a group of 3 and 2 people hit their deductible, that blows that percentage out of the water. But overall, when you take the large number of people, it's roughly about 30% that hit their deductible. So when an employer is refunding or reimbursing an employee towards their out-of-pocket deductible, odds are they're never going to reimburse 100% of their employees. It's some of them, not all of them. So we have an example here on the screen where this is a group of 25 employees. Their premium was $300,000, fully insured. They moved to a plan with a higher deductible. Premium came in at $250,000, and then the employer has $30,000 potential out of pocket if they met everybody's deductible. So that means this employer is paying $250,000 in premium and $30,000 potentially, not guaranteed, in potential employee deductibles. That's $280,000 right out of the gate. This employer saved $20,000. But if we look at the fine print down here at the bottom, it actually could be higher than that based on the total utilization. So that employer says, I put aside $30,000 for deductible, but only a few people hit their deductible and they only dug into that maybe 10 grand. There's another $20,000 of savings that employer can see. This isn't the best fit for everybody under the sun. Some groups have already moved to higher deductibles. Sometimes it's harder to generate that savings to make it make sense in the long run. But that's something we do behind the scenes. That's Dan and I all day long. That's consulting at its best. That's us crunching the numbers, looking to see if this is a concept that you need to be aware of, that we should be talking about. So HRAs, not to be confused with an HSA, is another type of funding arrangement that can help an employer save some money. I'm going to tell you, just before the Affordable Care Act was passed, everybody under the sun was doing this. The reason being is, before the Affordable Care Act was passed, there was a much greater savings when you moved to higher deductibles. the spread between the lowest plan and the highest plan was much, much, much greater than it is today. That's one of the things the Affordable Care Act did, was shrink the cost difference between the lowest and highest price plans. So an HRA isn't that no-brainer than it was 10 years ago, but it still has a place where it fits for a lot of groups. We just need to figure out if that fits for you or not. Next thing we want to move on to, self-funded, level funded. The truth is, when you really, really get into it, level funded is nothing more than a version of self-funded. Different words to kind of mean the same thing. But these are really some of the greatest plans under the sun today, if it works for you, if it's a good fit for you. We, as a company at JRG, before we merged and became part of Emerson Reed and My Benefit Advisor, we're putting together level funded options exclusively for chamber members. We're proud to say today, not only do we have exclusive level funded options for chamber members, but we actually get discounts from national companies that offer level funded products that other people don't get for chamber members. So we've got some really exclusive options and really neat deals. What is self-funded? What is level funded? So here's the best way for me to describe this. First thing, when I say self-funded, I know a lot of people kind of tune out and they get a little scared and they say, oh, that's not for me. The truth is, self-funded works for groups all the way down to about 5 employees. Self-funded is, this product is packaged in a manner that it doesn't have the volatility that a true self-funded plan would. So first off, what's a true self-funded plan? You think of a large company with 20, 30, 50,000 employees. They go truly self-funded. They go and they pay an insurance company to use a network like Cigna, United Healthcare, the Blues, and then every claim that comes in, that company pays it out of their operating expenses. Now, sometimes those companies will go contract with a third-party company to protect them from some really, really large claims. They get what they call a stop-loss policy. But true self-funded is where a company says, as the claims come in, we're going to pay them. That's not a good fit for all size companies. And specifically, you get under a few hundred employees, and that can be really scary. That's where level funded as a new concept is really popular these days. And that's where it provides the protection and the less volatility. So here's what level funded is. Level funded, an insurance company will look at your group. They may ask you to complete yes and no medical questions for your employees, or they may forego the medical questions and look at something like a prescription database report that they can get their hands on. I hate to say it, but our information's out there everywhere. So these insurance companies have access to databases where they can find out things about us. So the insurance company will start by assessing the risk of a group. Once they assess the risk of a group, they come back with a rate. Now, the first thing I want to mention, if you're under the ACA today, all your employees with different ages have different rates. A level funded plan is not like that. It's old school in that everybody who's an individual has the same rate. Everybody who's a parent and child has that, they have the same rate. The families all have the same rate. So it makes it easier to hire people knowing what the cost is going to be to you. So the insurance company sets the rate. That is your rate for the year. That is your rate for the individuals, for the families. That's your rate. Each month, as the month goes through, our team gets a report behind the scenes that talks to us about your claims usage in the previous months. So my team's going to get some data that says you've had a couple employees who did this, this, and this. My team's going to review that. They're going to look for areas that we can come back to and make recommendations. And then throughout the course of the year, because we get that data, we're going to know how well you're performing. At the end of the year, if your group did not use what the insurance company anticipated as far as claims, if they said, here's your rate, but really your claims came in below that amount, they're going to give you money back. Some of our options refund 100% of the difference. Some give you 50% of your premium money back, and they keep 50% for doing business. But there's a lot of these different level funded products out there. So the benefit to an employer it's a few different things. Number one, the way the Affordable Care Act is set up, it is a giant bell curve. What that means is the majority of the groups out there are paying the claims for those that don't warrant them. A lot of the groups, I've heard estimates that 70% of the groups under the ACA rating model are paying more than they truly should for benefits, because they're helping spread out the risk and take on the risk of everybody else. If you're one of those groups that you are paying much more than you should, level funded will help you save money right out of the gate. The other side of level funded is we're going to get claims. Like I said, we're going to get data on a monthly basis. My team researches that. I'll give you some great examples on how we've helped people. We get the claims data and we see 2 employees are taking a prescription drug that is very, very high costing. We reach out to the doctors. We ask the doctors what their thoughts are. If there's other drugs in this category that are good, that work well, that can be recommended, we go back to the employee and say, have a conversation with your doctor. If your doctor feels that one of these others are a good fit for you, your copayment's going to go down a lot. And by your copayment going down as the employee, the employer saves money and you get a better renewal next year. So it has this trickle down effect that it really benefits everybody. So we get the claims data, we research it, we come back to the employee and the employer and let them know if there's things they can do to control their cost. And then at the end of the year, you have the potential to get money back. First question I get on this product every time is, what if our claims are through the roof? What if it's a really bad year? Well, that's kind of what happens in today's model sometimes. We get a big renewal. And then Dan and I have to go out and do our homework again and find you something different. But you don't have to pay anything back if you get if you have a bad year. You don't owe them money. They say, we estimated you here, you came in above that, that's our loss. So the nice thing is, it can become a win-win for an employer. It can give you a lower rate. It can give you access to data to help you control your cost long-term. And typically a level funded play is usually like a 2 or 3 year play, because, you know, unless your claims the first year come in and show us that somebody has something long-term that they're going to have to, insurance companies are going to have to pay out on every single month, somebody developed a disease or something, typically the claims aren't like that. They're one-off claims that level funded becomes a smart play for a couple years, because you can affect what you do the first and second year and get lower renewals the second and third year. So it's a really neat option that's out there. It really helps people control their benefits, control their costs, reduce their premiums. And with these type products, there's a lot of level funded products out there. Your local insurance companies, Capital Blue Cross has a very strong one in your area. We have a unique one that we put together exclusively for you that uses either the Cigna network, very large network. We can use the Blues network, or we can use United Healthcare's network. United Healthcare and Aetna both offer level funded products. They actually provide us a discount for you as a chamber member. So if Dan and I do our homework, we go out, we dump all the puzzle pieces out, we come back to you and say, hey, you know what? Level funded might be a good fit for you with United Healthcare. And guess what? I get you an additional discount that nobody else can get because you're a chamber member. So our approach is always truly to find the best product for you out there. It's not a one size fits all. But when it is something different, we've got discounts. We work with every insurance company out there, and we've got discounts for you. Last thing I want to talk about here in the medical before I pass it over to Dan to talk a little bit is about what we call group medical captives. Group medical captives. This is, some people will know that this is like a MIWA, a Mutual Employer Welfare Association, but it's essentially where we take a group, lump them together. We take hopefully all good risks together. And by sharing in that risk, these groups can see better benefits. They can have better cash flow throughout the year. They can have better renewals. But it's just another way that we can help you as chamber members. Again, not any one of these is a one size fits all for everybody. But within everything we have, there's something that will fit everybody. And a lot of the stuff that I talked about here is available for groups, basically of all size groups with group insurance. But Dan and I want to make sure we're kind of clear here on a couple things. And I want to pass it over to him to talk a little bit. when it comes to group health insurance, as a company, we help you, whether it's individual, whether you're a group of one, like a nonprofit, or you're a sole proprietor with an employee, a group of two, or you've got many employees. But not all of these benefits fit for everybody. A captive might be good for a smaller group, but a level funded might be only good for a group that has maybe 5 employees or more. That's where we do our homework. So what I've talked about now is more in the group side of things. And a lot of these things are maybe 5 employees or more. I want to pass it over to Dan to talk for a few minutes. The truth is, when you come to the chamber and you come to my benefit advisor, no matter what your situation, we're going to be able to help you navigate it. We're going to have multiple options for you. We're going to do everything that every other broker under the sun does, and then some and more. And so when it comes to groups of the smaller size, under 5, under 10, in that area, I want to let Dan talk about some of the really unique products that are out there for that. We've had some law changes over the last couple of years, some unique products that come out, different ways to skin the cat, so to speak. So I'm going to kick it over to Dan. I want to pull a page up for him, and I'll let him talk a little bit about individual and small group for a second. Thanks, Dan.
All right. Thanks, Craig. Yeah. And as Craig said, we love to use our anagrams, acronyms here in the insurance agency. So I'm going to fortunately throw another one at you. So briefly, I'm going to go over kind of the other solutions for individuals, but also for the small group companies, and kind of solutions I found over the years that are useful. But this first one is very new. It's individual coverage HRA. You may have heard it as ICHRA. And what the main thing with this is, before it kind of was around and the employers could give a little bit of money to employees on a pre-tax basis to pay for their own health insurance. But now that it's subject to, you can provide as much as you want to your employees, and they can pay for their health insurance premiums with it. So it's not a group health insurance plan. It's more so a contribution to employees for them to go out on their own and get their own health insurance. One of the main reasons for having this plan would be you want to define costs. So you say, as the employer, I want to make sure I'm only paying X. And you can do that with this because you provide that amount. The employee chooses to either enroll in a health insurance plan and accept that reimbursement, or not have health insurance and they don't get the reimbursement. One of the big things I think is very important with us is, let's say you decide you want to do it and you have 6 or 7 employees. We will talk to each 6 or 7 employees and choose which plan they want. So I'll briefly go over, obviously at the top it says it's an alternative to having a group health insurance plan. It's subject to certain rules and an employer may establish. So one of the things is, you could say, and especially with if they're going out and getting insurance on their own, their rate is going to vary based on how old they are. So, let's say a 60-year-old's rate $600 and a 30-year-old's rate's $300. You could say, I will contribute, instead of saying $300 and, that the younger employee gets it for free and the older employee still has to pay $300, you can say, I will pay, $100 for somebody 30 to 40 years old, and I'll pay $300 for somebody 60 and over. You as the employer set that level based on an individual's age. They can use the money that the employer provides them to pay for all, if it covers all of it, or some of their insurance premiums. Again, there's no limit on how much they can fund. Available to any employer of any size. It's subject to strict rules for compliance. So we partner with a company who administers these, and they actually help you do that. And Craig's also going to talk about something else that we offer called Think HR to all of our clients, that will also help you with that. And it's free of charge to you as being a member of the chamber. It's favorable tax treatment. It's for the employers, and it's also not taxable income to that employee. So them getting the extra $200 or whatever in the paycheck, they don't have to pay taxes on that. And it satisfies, obviously, the Affordable Care Act and what's considered major medical insurance. And this slide's, these all go out to everybody, but this is, who is eligible. Basically everybody. Almost, if you look through this list, almost anybody that is affiliated with your company in some way will be eligible for this, but you can define who is eligible for it. So you could say you have to work at least 30 hours, to offer it.
Dan, hey, hate to cut in here real quick, but we do have a question. Can I interrupt you real quick?
Sure, go ahead.
Yes, we had a question. Legally, can an employee work for an employer for no compensation, but have health coverage offered / covered as a benefit? So no paycheck, but you get insurance. I know, weird question.
It's not a weird question nowadays, but before the answer is definitely no. Craig, would with all this furloughing and stuff going on, my answer is typically still no, because you get into some really hairy things. But have you run into that, Craig?
So if somebody asked me to answer that, I would make some guesses that the Department of Labor and the IRS defines an employee as somebody who is compensated in some way. But ultimately, I would refer them back to our free HR compliance and attorney team at no cost to ask that question and get the answer in writing. And I'm going to talk about that benefit coming up. So I think in the end, Dan, you and I would probably take some guesses, but just refer them back to Think HR.
Yeah, because one of the big things that's happened is employees are keeping their employees on the health insurance that aren't working. So they're still contributing because they're considered furloughed. So that's the exact opposite of that situation. But yeah, that's, let's say if they came to us with that question, we would be able to direct them to Think HR and say, look, just make sure, this is okay or not okay.
Thank you so much.
Sure. And Craig, you can go to the last slide. So just another solution, and this is kind of, something I find very beneficial in my years of experience working in the Medicare field, is we have a whole team of individuals that will help employees or former employees get set up with Medicare. Where this really comes into play, and I just did it for one of my small companies that was, it's just her and her husband both worked there, and he was turning 65 and his health insurance was a fortune. And, I was able to tell him, you're turning 65, you need to move over to Medicare, and here's who you can talk to. And we were able to save that employee more than they were paying less than half when they ended up going to Medicare. Because what happens with Medicare is if you are a company that is less than 20 full-time employees, that employee who is 65 years old or eligible for Medicare in another way will have to elect Medicare Part A and B, and that employee pays a premium for Part B. So if they do not do that, then they don't have coverage, because the primary insurance carrier will say, we're not going to pay that claim because you're supposed to have Medicare. So typically for companies less than 20 employees, and a retiree plan, or having them move individually to Medicare is beneficial for the employer on a cost basis, because their premiums are going to be a lot less, and the employee, because they're going to have a much richer comprehensive plan in most cases. So it usually works out for everybody, and doing primarily Medicare for a couple of years, it's been the one where I get the feedback from the employer or the employee that they're glad they made that decision. Now, if you're in the larger group, typically it's probably the reverse, where that's not an option unless a group retiree benefit's being offered. But obviously that's something we can look into too. And lastly, I just want to touch on small group benefits. So we work with all the carriers in the area, the UPMCs, the high marks. And one of the things me and Craig were talking about earlier is there's a benefit that not a lot of people know about, as we can get a group insurance plan for sole proprietors. So if it's just you and you're looking for an insurance plan, in a lot of cases, there's a carrier out there that we can find for you that you can get on a group basis instead of go and get it on your own, paying your premiums with after-tax dollars. Specifically, most nonprofit organizations were able to do that for. And just to end, just because, Craig went through a bunch of the products that we can offer, I just want to kind of go over a story that just, happened. I had a client on a level funded plan, and they were in the entertainment industry. They came up for renewal when I first came over to this organization. We got them the 2% discount because of the affiliation with the chamber, and they obviously are hurting a lot from being in the entertainment industry right now. They were very low utilization of claims. So I told him, I said, look, here is what I gave him a very conservative guess because we get that claims information that Craig was talking about. I said, here's what you can expect back. They got a lot more than what I gave them, and they were able to stay in business basically. So, obviously, like you said, it's not a fit for everybody, but that's what we're here for, is to find out what's the best fit for you. So thanks. I'm going to turn it back to Craig for the rest of the presentation.
Thank you. So one last thing I want to talk about here as it relates to consulting from a medical standpoint. We've given you a lot of examples of how we operate a little differently to find the best fit for you out there. Again, we go out to market the same way every broker does. But we have all these unique things that other people don't have. And one last thing I want to talk about in the medical area before I move on to just some cool added value benefits is a PEO. You might be hearing more about PEOs. PEO stands for Professional Employer Organization. Some of your payroll companies today offer PEOs. There's some independent companies offering a PEO. Essentially, what a PEO is when we take and package a whole bunch of benefits together to help you manage them and save time, save energy, kind of operate as your backroom HR department. So a PEO might include things like your payroll, your medical, your dental, your vision, your life, long and short-term disability. A lot of times we have ancillary benefits on there like AFLAC voluntary type benefits. Sometimes there's pet coverage on there. It includes your 401k, your workers' comp, and it's all packaged together. You have one premium that you pay for all your benefits. The benefit of a PEO is, though, they handle all the compliance for you, all the backroom enrollment. You get a free enrollment website to do it all electronically. So this is all packaged. The compliance is all taken care of for you. Companies who are a good fit for a PEO traditionally will find significant savings, both in cost and time management. So that's just another one of the tools we have in our toolbox. When we reach in to put your puzzle together, so to speak, we're looking for the best tool in the toolbox, and this is another one that we have there. But I really want to move on, and I want to move through this next part kind of quickly, but this is my favorite part of the presentation now. This is really where we separate ourselves. And I'm going to start, I laugh every time I say this, but I'm going to start this way. What I'm about to say, all these cool extra benefits that I'm about to talk to you about. If you say, Craig, I love the health insurance plan I have in place today, you can keep your plan and get these extra benefits that I'm about to talk about. I laugh because that was the big saying when the Affordable Care Act was being passed. If you like your plan, you can keep it. But we're going to go back and I'm going to talk about some really cool stuff that we do when you become a client of ours. So first thing we want to talk about is benefit management. As soon as we get you set up with us, we're going to do a couple things. We're going to provide you access to our local call center. That's a team of people that answers the phone that are there to help your employees and their dependents with things like, I lost my card. Is this claim legit? Should I pay it? How can I find a new doctor? Those are all those sort of things our Client Resource Center, Benefit Service Center will help your employees with. But what I really like is we're going to assign an account manager to every group that's going to set up a 12-month service calendar with you. I love this. Too many times we hear I only talk to my broker at renewal. We're going to schedule It could be monthly, it could be quarterly, it could be every other month. You're going to tell us how many times a year are we going to talk. Might be a 5-minute conversation to say, how's benefits going today? Might be a half-hour conversation to say, hey, level funded is a new concept I want to talk to you about because I think it might be a good fit for you this year at renewal. Either way, when we set up our service calendar, your renewal comes up, we know what we're walking into. We know what kind of plans we should look at. We've talked to you throughout the course of the year. We know exactly what to do and how to be beneficial for you at your renewal. So I love the fact every group gets assigned an account manager. They get assigned a team to answer their questions behind the scenes. It makes everything go much, much, much smoother. Skipping ahead here a little bit, our Benefit Service Center. This is our team that's just available. And this is not available for just the business owner, but every employee and their dependents. Inevitably, every time Dan and I do a meeting and we talk to the group of people there, half the people in the room will say things like, you know, the person at home is a decision maker. I got to go home and talk to the boss. I got to run this by the boss. That's okay. Have the boss call our team. We'll talk to them as well. I mean, the boss at home. So Benefit Service Center, healthcare advocacy. Our team will help you navigate through tough situations. You get a claim you shouldn't have received. Far too many times, people go to the HR person, say, what is this all about? Or they're embarrassed to go to the HR person because it's a claim for a doctor they don't want to bring to their boss's attention or the people around the office. And what does that person, the HR person, do? They tell them to call the insurance company. Well, you know what? Monday's a high call volume day. So is Tuesday. Oh, guess what? So is Wednesday, Thursdays, and Fridays. Call our team. We got you covered. Form 5500. If this applies to you, you know what it is. It is a form as a result of the Affordable Care Act that needs to be filed by certain size groups. It's a legal form, and it carries a very significant fine for not filing it. Again, if this doesn't make sense to you, that just means it doesn't apply to you. You'll know if the Form 5500 applies to you. Unlike the compliance I'm going to talk about in a few minutes. We do the Form 5500 filing. We've got a team of people that takes care of that for you. So that's something that can help employers save time and money. COBRA. You know, federal COBRA says if you have 20 or more employees, you have to offer continuation of benefits to your employees. But what a lot of people don't know is in the state of Pennsylvania, if you have less than 20 employees, you are subject to Pennsylvania mini COBRA. Says you got to offer continuation of coverage. If you're federal COBRA, if you have more than 20 employees, we've hired a team behind the scenes to handle COBRA for you. If you're mini COBRA, our service center is going to help you navigate through there. We're going to help get you the letters you need to send out, talk to you about the things you need to do, talk to the insurance companies for you. We'll help you figure that out. COBRA's big. You don't want to screw somebody up on COBRA because it has impacts to them when trying to get insurance on the Affordable Care Act under the marketplace. So you got to be very careful. You got to make sure you handle COBRA correctly. My favorite added value benefit today, Dan and I have already mentioned it once or twice. The reason this is my favorite, because there's not a day goes by that I don't hear from somebody about utilizing this benefit. Every company that we manage their medical benefits gets access to Think HR, which is a top of the line human resource website that does 3 main things for you. Helps you stay in compliance. It's updated with this giant database of all this information that you could access, you know, things that are very common. All the most commonly asked questions, issues are all handled there. But the comply section that's getting, the biggest part of that's getting used today is the handbook builder. We have what's known as a living handbook builder. A living handbook means that you plug in your information, it's already got all the federal and local and state information housed in there, and anytime the laws change, your handbook automatically updates. This service, believe it or not, we have a client that paid $25,000 for an attorney to build their handbook from scratch. That's insane. Most people are spending a couple grand on a handbook. We'll give it to you for free. You guys are really special, and you guys are the best association we work with, and don't let anybody tell you any different. But we do manage a couple other associations like you, And one of them, a couple of them are the bar associations around New York, Philly, Allegheny County, Pittsburgh. They use this. That's why they like us, because they can build their employee handbooks using our services. So this is a great tool, and it is backed by HR professionals and attorneys, and it will save you a lot of money. If you feel still inclined, go back to your attorney and have them review it at a much, much, much smaller cost. But here's a free handbook for you. Now, why is a handbook so important today? Because I don't know one company that had furlough or COVID in their handbook prior to today. So a lot of people are redoing their handbook to put language in there about furlough and their benefits. Do they continue? Do they not? So Think HR is a great tool just right there on itself. But what most people use Think HR for is Think HR Live. That is a team of HR professionals, legal professionals behind the scenes that you can email or pick the phone up and call as many times as you want a day. And they're going to give you the answer, not only over the phone if you call, but also in writing, so that you have a record of it. You know what to do. I don't know how many people have attorneys on retainer, but I hear that costs a couple $100 for a call. 10-minute calls gets charged an hour. Usually that's a $200 or $300 call. Here, you call them all day long at no charge. We give you that service. And there, like I said, there's not a day goes by that I don't hear from people how much they love Think HR, just that part of us alone, because they can call and say, I had to furlough an employee. I'm bringing them back. They used some PTO, but not all their PTO. And they got, how do I handle that? I don't know. Dan may know, but ultimately we just say, call Think HR. That's the professionals. And then Think HR Learn. Pennsylvania as a state does not mandate that we run through a whole bunch of educational courses yet, but a lot of states do. A lot of states, you hire somebody, they have to go through anti-discrimination, anti-sexual harassment, maybe active shooter training, maybe just customer service. These courses could cost hundreds of dollars. We'll give you the whole library for free. You want your employees to do a customer service class? We'll give it to you for free. You want them to do an anti-discrimination or anti-sexual harassment? We'll give it to you for free. So Think HR is a really powerful tool these days. Last kind of like benefit under this category that I want to talk about is Goodly. And Goodly is a specific product. I want to talk less about Goodly and more about the concept, tuition reimbursement. You can search the studies out there. Goodly has their surveys. They're all over the internet, and you're going to find the same results just about in all of them. When they survey employees, particularly younger employees, your millennials, and ask them certain questions, inevitably, a very large portion of them, a very large percentage, want their employer to help them with their school loans in some way, shape, or form. They're willing to forego retirement plans and certain benefits when questioned, when asked, what do you want from us as an employer? My student loans covered, help. So we partnered with Goodly. We have exclusive deals for you. But we also work with everything that's out there. And there's a lot of options. And again, that's where Dan and I, that's where we do our consulting homework. If you say this is a benefit that you think would be good for your employees, or we think it's good for your employees based on your census data, we'll talk to you about this. The truth is there's a great return on investment for employers, and there's a tremendous return on investment for employees. Biggest return on investment for employers, though, is retention. Every survey under the sun says that people will stay with their employer longer if they have this benefit. So that's a pretty impressive benefit that's out there right now. It's gaining a lot of traction, a lot of talk of student loans. So next I want to go into a couple things here, and I'm going to speed it up just a little bit. Enrollment. I mentioned earlier how important enrollment is today. We've got a lot of companies that have a lot of employees working from home. A lot of companies are saying that a lot of my staff may continue to work from home even post-COVID. How do we handle open enrollment? There's lots of ways to do that. We have exclusive rights to give you, your members, access to enrollment platforms where I can go online, provide quotes to you as a group, send you a link that you share with all your employees, and they go right online and pick the plan they want, how they want to enroll. I want me and my dependents, me and my spouse, me only. We have so many different versions of that we can provide to you. Different size groups are eligible for different things, but at the end of the day, we can build a guidebook for a group. You're handling your open enrollment via paper, and you're printing stacks of stuff, and you want to pretty it up, and you want to make sure you have the accurate information in there. Let us know. We'll put together some guidebooks. There are size requirements for guidebooks because of the work behind it. There are size requirements for benefit videos as well. But this is where we build little like 30-second, 60-second brain shark videos. Somebody wants to know what a deductible is and what my deductible is on my plan. They watch a 30-second video. Then they click on the one that talks about how to enroll. So we create brain shark videos for our groups. I mentioned our benefit call center earlier, but we also will open up an open enrollment employee hotline. You say, Craig, it's open enrollment season. We're unveiling 3 plans this year. It's the first time we're going to give our employees choice between a high deductible, an HSA, and a very rich low deductible plan. And we want them to have somebody that they can call and talk through their scenario. Well, that's our team right there. We do that. We'll open it up usually like 30 days in advance. We'll typically keep it open for about 30 days afterwards. And it's benefit questions. It's for the employee and the boss at home. And then lastly, online enrollment systems. I kind of touched a little bit on this. There are different levels of this. I have the basic, you click on it and pick your plan enrollment, all the way up to the most comprehensive $10,000, $20,000 build from scratch employee benefit enrollment systems. If you're of a certain size, we will build this for you for free. That 10, 20 grand that it costs for a tech team behind the scenes to build that out for you, we will do that for you for groups of a certain size. And we've lowered that size down for chamber members exclusively. So finally, last couple things I want to talk about here is compliance. I apologize for saving this to the end because it is probably one of the scariest things that you guys will hear, but here's the truth of it. 1974, people were messing around with retirement accounts. ERISA was passed, Employee Retirement Income Securities Act. It was passed because of things like 401k plans, but it encompasses all employee benefits on a group basis. So you offer dental to 2 employees and that's it, you're subject to ERISA. You offer medical, dental, vision, life, you are subject to ERISA. And ERISA says that as an employer, when you offer group benefits, you need to provide your employees a minimum of 12 documents, 12 disclosure notices. We know some of them: HIPAA, COBRA notice, the Medicare Part D notice, notice of the marketplace. Some of them, though, I say to people and they go, oh, I never heard of that one. You know, the QIMSCO, the Women's Cancer Right Act notice that applies to men also. These have to go out on a yearly basis. We will help you with these. We're going to help you with compliance in a few different ways. First off, behind the scenes, we have a team of about 8 or 10 attorneys from around the country that will be up to date on everything legislative every single day, who will then filter that information down to Shelley Bloom. Shelley's local to you guys out there in your area. Shelley's area of expertise is taking legal information and breaking it down for an employer and telling them what they need to know. So we do, weekly or monthly kind of short compliance updates. Hey, here's what changed in the laws. Here's what you need to know as an employer. I also bring Shelley to certain groups to say, you want to have a conversation just specifically about your needs? Let's set something up. She is our expert when it comes to translating legalese into something that I can understand. So we start with Shelley. We help you with your compliance. I mentioned 12 disclosure notices. We're going to help take care of getting all that stuff out for you. Your annual notices that have to go out every year. I mentioned a couple of those, the CHIP notice, the HIPAA, privacy, but there's 12 of those. Here's the scary part with compliance. As a result of the Affordable Care Act being passed, in order to get the Affordable Care Act to pass, we had to concede certain things in there that were going to generate money. So the Affordable Care Act came up short on money right out of the gate day one. Well, the Department of Labor was told to hire new agents so they could go out and audit businesses to make sure they're doing all the things they should be doing. As a result of these audits, Groups are being fined. Now, you might get audited for an OSHA audit, but they might turn around and ask you to audit you also while they're there for all this information as well. They're going to say, show us proof that you handed out these 12 notices and that they were received by your employees. We can help you with this, and here's why it's so important. A lot of those notices carry fines of up to or around $117 per employee, per notice, per day. So let's just do some quick math. I got 10 employees. There's 12 notices. That's 120 notices I should have gave out. I didn't give them out. That's $117 times that number. Oh, and I didn't do that for the last 2 years. That's times 700. You can see where those numbers can get into the millions for groups. We've had groups call us as they were being audited where we've gone back and helped negotiate lower fines for them, or we've proven that we've already given them all these notices. So if you're offering benefits and you're not in compliance, you should be working with us just for the compliance side of things. We will protect you from that side of it. I know that was a lot. I know that feels like drinking from a fire hose. I want the main takeaway today to be that when I join the chamber and I have access to ChamberChoice, I have access to every single thing out there that every other broker does. I've got some discounts that other people don't have, and I've got some awesome protection behind the scenes. I've got some great added value benefits. Oh, and you know what the cost of all this is? Zero. We will take money out of our commission that we make. We're going to share some of it with Jordan and the chamber so that they can further promote you. And then we're going to take some of that commission and we're going to buy all these added value benefits for you. That's how we're different than your other brokers out there. Questions?
Craig, right now, just had somebody say good info and great presentation. Learning about Goodly was a total bonus. Thanks to all. So certainly appreciate that.
Excellent.
Anybody else have any questions? And please go ahead and type. I just want to say something here quickly too. So again, this was recorded. So what my hopes is that us as a chamber, we'll put this on all of our social media pages, this presentation, and Craig and Dan both did a great job of seriously going through almost everything that the My Benefit Advisor group offers. So they hit on the groups larger than 10. They hit on the groups under 10. They hit on single groups. So basically what I wanted everybody to get out of this presentation is if you need some help, please contact Craig at the My Benefit Advisor team and the My Benefit Advisor team, or Dan, whoever it is that you need to contact. And as you see, I think Craig, you put your contact information right here as well. So please, anybody that's in here right now, go ahead and jot that down so you have it. And then if you'd like, I will also share your information with Craig so he can reach out to you after this presentation.
Awesome, guys. Yeah, we'll make sure we get Dan's contact over to you as well.
Well, look, Craig, I'm not seeing anything coming through right now. I think you really did a great job of hitting everything. I really, really appreciate it. And Dan, I thank you for your time as well. Thank you so much.
All right. Thank you, Jordan. Thank you, guys.
Take care, guys.
All right, Craig, take care. Take care, Dan. See you guys later.
Bye-bye.
Bye.